Why is a transplant coordinator crucial for kidney transplants? Imagine trying to navigate a complicated maze without a map or guide. That's what going through a kidney transplant can feel like for many patients. A transplant coordinator acts as that essential guide, helping patients, families, and medical teams work together smoothly. For people with chronic kidney disease who reach the final stage and need a transplant, having a dedicated coordinator can make all the difference in outcomes and safety. One of their main jobs is to support patients before, during, and after the transplant process. Before the surgery, they help patients understand what tests are needed, explain eligibility criteria, and organize appointments that can take several days. They gather medical histories, coordinate tests, and communicate with insurance companies to ensure coverage. This helps patients feel prepared and reduces the stress of managing complex medical paperwork and scheduling. Coordinators also play a vital role in education. They explain how the transplant works, what medications are necessary to prevent rejection, and lifestyle changes needed after the surgery. They answer questions from patients and families, making sure everyone understands the risks and benefits. This education helps patients make informed decisions and manage their health long-term. Throughout the entire transplant journey, coordinators serve as the link between different healthcare providers. They work closely with surgeons, nephrologists, social workers, dietitians, and other specialists. They ensure that care is continuous whether the patient is in the hospital or at home. For kidney transplant recipients, they often stay involved for many years after surgery. They monitor kidney function, review lab results, and help manage medications to catch any problems early and prevent rejection. Another crucial part of their job is coordinating the matching process between donors and recipients. They look at blood types, how close the donor is to the patient, and how long someone has been waiting. When a suitable donor becomes available, they organize the logistics, communicate with the organ procurement organization, and coordinate the transplant team. This process requires quick, efficient communication to ensure the transplant happens at the right time and under the best conditions. After the transplant, the coordinator's role continues. They plan discharge, explain post-surgery care, and schedule follow-up visits. They teach patients how to take their medications correctly, recognize warning signs of rejection or infection, and stay connected with their transplant team. Because kidney transplants requiring lifelong management, having a dedicated coordinator helps patients stay on track and feel supported throughout their entire journey. In the end, a transplant coordinator is essential because they improve safety, reduce confusion, and help ensure the best possible outcome. They make the complex process of kidney transplantation more manageable, giving patients a better chance at a healthier, longer life. For those living with end-stage kidney disease, this role can be the key to a successful transplant and a brighter future. Always remember, if you or someone you know is considering a transplant, talking to a qualified healthcare team, including a transplant coordinator, is the best step forward.